So my name is Emmett Stones. I'm a clinical psychologist working in adult mental health services for the HSE in the Cork Kerry area. So a psychologist is a health professional who assesses and treats psychological difficulties associated with mental and physical health. I suppose our aim is to reduce psychological distress and to improve and enhance well-being. So typically a referral to psychology will be made through the community mental health team. So that might be through a person when they're inpatient in hospital as part of their individual care plan, or psychology is identified as a need and a referral is made, or that a person is working with another member of the community mental health team and a need for psychology is identified and a referral can be made that way. A person can of course request a referral to psychology as well if they're motivated and they feel that they'd benefit from that. Typically if a person starts attending with a psychologist, we'd start with an assessment. And that assessment really is to kind of work to get a very detailed understanding of the individual, of the person and the difficulties that they're experiencing. So usually it will include kind of an interview where we'd kind of get a sense of the person's difficulties, I suppose their strengths, their goals for therapy, their early life experiences, also looking at their current situation, their relationships, what's happening for them in their life. So we'd be kind of working that way. I suppose sometimes if the person is agreeable, it might be suitable to speak to a person that knows them well, a family member with the person's consent and permission, that could be part of the assessment. A person will often be asked to fill out checklists and questionnaires as part of the assessment process with a psychologist as well. In some instances, a person might be referred for what's called a cognitive assessment, in which case we're looking at your kind of strengths and difficulties, maybe around learning, or there might be a query about a person's memory difficulties, and a psychologist might be asked to kind of assess that and to look at that. A psychologist is usually trained and familiar with a couple of different models of evidence-based therapy, and kind of following from the formulation and the assessment, they will identify kind of with you what therapy might be the most suitable to meet your needs. So for example, in some therapies the focus is very much on how the person's thoughts, feelings, body sensations and behaviours are related to each other, and kind of learning skills maybe to manage unhelpful thoughts or to change behaviours that are causing a problem to the person, or to manage stress in a different way, or to have skills around, say for example, relaxation. In some therapies the focus is more on exploring how the person's present feelings are associated or linked with past experiences, and also working on maybe unresolved memories or traumas that the person has experienced. Often in therapy, when a person is working with a psychologist, the focus can really support their recovery, when we look at their values as well and what gives them meaning and purpose in life, and then supporting the person to identify goals in relation to their values, or maybe exploring, well, what are the barriers, what's getting in the way of me pursuing a valued life or achieving my potential, and that focus can often be in the one-to-one therapy as well. So psychologists work with people individually, but also work with groups. And in the adult mental health services in Cork and Kerry, there's a programme of groups that is offered through the psychology department. And a person can be referred to these through their community mental health team. And those groups would be targeted at specific sets of difficulties that a person might experience in terms of their mental health. And once a person has been referred to a group that's being offered by psychology, they'll usually get an assessment initially just to be sure that the group is the right group for them to meet their needs. And then the person will be invited to take part in the group. The feedback from those groups is that people find them very helpful, both in terms of learning skills to manage their mental health and to kind of cope better, but also through meeting other people who've experienced similar difficulties to them, and they realise that they're not quite as alone with that, and sometimes it reduces the sense of stigma and isolation from that. So it's a really positive and important part of what we would do as psychologists in terms of the mental health services and supporting people with their recovery. So psychologists are mostly based in the community, but they do work with people while they're inpatient in hospital as well. So the types of encounters you might have with a psychologist while you're in hospital would be at a meeting where you're looking at developing your individual care plan, and the psychologist would kind of take part in that process alongside you. Psychologists often will contribute to therapeutic programs for patients on the ward as well, and a person can attend those while they're in hospital and will meet psychologists in that context. Sometimes if a person is referred to psychology, and they're going to be working with the psychologist when they leave hospital, maybe when they're better. A psychologist might meet them on the ward initially just to introduce themselves and to make contact so that they know who they'll be meeting when they leave hospital. So that kind of a contact would be there. At times, a psychologist might do an assessment of a person while they're in hospital as well, for example, a cognitive assessment. Personally, I feel very lucky to work as a psychologist, and it's a real privilege that a person will take you into their confidence and trust you with their story and maybe share some of the most painful experiences of their life with you. I suppose working with people, what really motivates me is to see people making progress and to see the resilience that is in people and the courage and the bravery of the people who come to me and work with me for therapy, and the resilience that people have in terms of recovering from really difficult experiences that they've had in their life, and to see people make progress and to fully achieve their potential.